Okay. Hi, everyone. First of all, thank you for the invitation. I'm an orthopedic surgeon and a sport medicine doctor. And nowadays, I'm working the OASI Bioresearch Foundation in Milan, Italy, and also in the Orthopaedic group in Brazil. And today, lecture, we will talk about preparing the soil, a way that we can optimize the results of our treatment in regenerative medicine. Today, I will focus especially in supplementation, supplements that we can use, every doctor can use to optimize the results of our patients. I declared no conflicts of interest. And when we look to an osteoarthritic joint, we should not look only in the anatomical change of the disease. We should see the joint as an inflammatory environment with a lot of cytokines like TNF-alpha, interferon gamma, and other inflammatory cytokines. And we also should look at the cells that are in the joint, especially the macrophage, the M1 macrophage, which is an inflammatory macrophage, and the M2 macrophage, which is a more regenerative macrophage. And we should look in our body as a tree. In a healthy soil with water, nutrients, and water, we will grow a beautiful tree. Whereas in an unhealthy soil, a dry soil without nutrients, we probably will not have a tree with high quality. And our biological terrain is composed of these five pillars, which are the nutrition, the food that we eat, and also the supplements that you can insert in the treatment, the physical activity of the patient, which is very important for the muscle mass, to protect our joints, the sleep quality. We know that when we don't have a good quality sleep, it blocks the regenerative process. Also the stress, the level of stress, because we know that the cortisol, which is the main stress hormone, has a catabolic effect in our body, causing the decrease of muscle mass and also cause disbalance of the glucose metabolism, and at last, the hormone balance, which is very important, especially the testosterone, which is linked to muscle mass and with a protective effect in our joints. Last year, we published this article linking metabolic syndrome with osteoarthritis, especially in the subchondral bone disorders. And this slide here, we can see in the B picture that red means a good quality bone and yellow a low quality bone. And we see in a patient without hypertension and diabetes that we have more quality bones, whereas in a patient in the J picture with hypertension and diabetes, we have more of low quality bone, and this low quality bone have changes in the trabecular structure of subchondral bone, which leads to decreased capacity of absorb impacts, leading to an overload of articular cartilage. In the future, it will lead to osteoarthritis. Now, I would like to talk about the supplement, which I consider the icing of the cake. And there are some supplements that we can take orally, like omega-3, magnesium, vitamin D3, and so on. And some supplements that we can take intraarticularly, like the hyaluronic acid that I know that most of the doctors here use in the daily routine, the glutathione, N-acetylcysteine, and also magnesium in a form of magnesium sulfate intraarticularly. The first supplement that I will talk is about the omega-3, which is very important because usually we have a diet with low omega-3, especially the animal forms of omega-3, like the DHA and EPA. And we know that omega-3 has anti-inflammatory properties in our body. And this article here shows that it increases and protects the dry mass of the articular cartilage, and also decrease the quantity of metabolites of type 2 collagen degradation. So it's very important to protect our body, and we will have to remember that we need the animal forms of omega-3, because some patients, they use the vegetable forms of omega-3, like alpha-linolenic acid, which is not used by our body and should be transformed in animal forms of omega-3. Another supplement that I would like to talk is about magnesium. Is a very important mineral in our body, and this article here shows that the intake of magnesium is totally linked to the level of pain in our patients with knee osteoarthritis. And I love magnesium. This is in the right side a picture of the mitochondria, and we know that the mitochondria have to produce our currency of energy, which is the ATP. And if we don't have magnesium inside the mitochondria, we don't have the ATP linked to the magnesium, and it's not bioavailable to use as a source of energy. So one of the first signs of magnesium deficiency is low level of energy. This article here shows the use of magnesium sulfate after surgeries, arthroscopic surgery of the shoulder, and it also can be used in surgery of the hip and knee to decrease the use of analgesics after surgery. The vitamin D3 is also a very important vitamin. It's called vitamin, but really it's not a vitamin. It's now we know that it's a hormone that interacts with most of the human tissues. And we know that the level of vitamin D is very important also for our joints, and especially for the articular cartilage. It has anti-inflammatory properties, and it's important for the development of the chondrocytes. It also decreases the collagen type 2 degradation in our joints. This article here, published in the British Medical Journal, shows that vitamin D deficient is very common nowadays, and we should try to reach optimal levels of vitamin D, which in this table you can see that is higher than 75 nanomoles per liter. And especially in Brazil, it's a country that we have a lot of sun, and we need the sun to react with the dehydrocholesterol in our skin to start the production of vitamin D in our body. But even with this good quality sun, we don't have a lot of vitamin D in our population. We can see a lot of vitamin D deficiency. Vitamin K2 is another important vitamin that I always use together with vitamin D3, because it's always protect the body, avoid the excess of calcium in our body, which is important for the bone and to avoid kidney rocks. And vitamin K is important because it carboxylates some proteins like the matrix GLA protein. That is very important to avoid calcification and in the articular cartilage, which can lead to inflammation of the joint and cause osteoarthritis. Another important supplement is the fisetin, which is a senolytic drug. I use this picture here from John Howard lecture that I watched, and fisetin is very important. It's one of the strongest senolytic drugs. We know that we have senescent cells that are old cells that are not working well in our body, and these cells increase inflammation in our bodies. So we have to decrease this number of senescent cells in our body to have a healthy body. And this experiment here, they use an 82-year-old man, and they first measured the number of senescent cells in the body of the patient, and they found 28.89% of senescent cells in the blood. And after only 45 days of fisetin in a dose of 100 milligrams per day, they decreased the numbers of the senescent cells to 3.8%, which shows the power of this simple supplement, nutrient that we can find in some fruits like strawberry and others. This clinical trial is being done by the Stedman Institute, and they are using 72 patients, testing the effect of this senolytic drug, the fisetin, in osteoarthritis patients, and until now they are showing good results. The next nutrient that I want to talk with you today is the turmeric, especially associated with piperine, which increase the bioavailability of the turmeric in our body. The turmeric has a bioactive compound called curcumin, which is a potent anti-inflammatory substance, and it has the efficacy tested in osteoarthritis patients. There are some articles that show that it has the same effect of ibuprofen without the side effects that we can find in the ibuprofen medication. We know that it's a potent anti-inflammatory, but the problem with the curcumin, which is the active component of the curcuma longa, is the low biodisponibility. And so to increase this, we usually use together with the piperine, which comes from the Piper nigrum tree. The next nutrient that I would like to talk with you today is the probiotics. We know that if we don't have a healthy lifestyle, we usually don't have health bacteria in our gut. And a normal person has around 2.5 kilograms of bacteria in the gut. So it's a lot of bacteria. We have more bacteria in our body than cells. So it's very important, this type of bacteria, and we can see that in osteoarthritis patients, we have this low number of this type of bacteria, the Akkermansia multinifila and the Faecalibacterium praunice. And there are some supplements available in the market that can increase the colonies of this type of bacteria to decrease inflammation in the whole body, protect the joints from osteoarthritis. The next supplement is the N-acetylcysteine, which is a precursor of the most powerful antioxidant in our body, which is called glutathione. And this article here did a comparison between hyaluronic acid alone and N-acetylcysteine alone injected inside the knee joint. And they showed that both of the injections showed a good result decrease in the pain, but only the N-acetylcysteine group decreased the number of C-telopeptide of type 2 collagen, which is a biomarker of collagen degradation. We have to remember that the macrophage can be transformed depending on the environment of the joint in M1 macrophage, which is an inflammatory macrophage, or a M2 macrophage, which has more regenerative properties. And our goal is to change this M1 macrophage to M2 macrophage. And we should remember that the molecular weight of hyaluronic acid can do this. And a molecular weight around 3,000 kilodaltons of hyaluronic acid can change the M1 macrophage to M2 macrophage, change the joint environment from an inflammatory environment to a regenerative environment. Thank you very much for the attention.
Thank you, Dr. Gabriel, for your presentation. And let me see if there are any questions. So how these nutrients basically are helping in the regenerative treatment?
It's helping a lot because when we are doing a study, we need to test one kind of treatment. But when we are dealing with our patient in the daily practice, we have to use different strategies to improve the results. So especially in the OASE group in Milan and in Brazil, the Orthopaedic group, we usually do the soil preparation before starting the regenerative treatment with PRP or other kind of treatment. And we are seeing better results when we do this preparation, especially change the diet, because the diet is totally linked to inflammation.
So do you also use glucosamine and chondroitin sulfate supplement in any?
We are not using glucosamine and chondroitin anymore because there are other supplements that showed a higher effect in the cartilage and in the pain of our patients. So we are not using this kind of supplements anymore.
Okay. So once again, thank you for this nice talk.
Thank you very much.
Okay.